Good morning.
Друзі, будемо розпочинати наш.
Dear friends, we are starting the second day of our summer school resilience through cooperation. And I suggest that we start by very briefly summarizing yesterday's evening. We had a networking evening yesterday, and I would like to ask you whether we have here uh, people in the room who have the bingo cards from yesterday. All right, great. So I suggest we do it this way. You can have a look at your bingo cards once again at these 16 people you have found. And there's one person and one story behind each fact. So I suggest we choose one person and share with the others whom you have found. I will start. I have found a person who has the experience of finding grant funds. That's Oksana Kobylecka from Ivano-Frankivska. So, Oksana, are you here? Not here yet. So, if you see Oksana, Oksana has a lot of experience at Teplemisto platform. She's now working on another project because Teplemisto has finished its mission and turned into a number of other organizations. I suggest that the others share as well. Thank you, Taras. My name is Valeria. Good morning, everyone. I haven't been. Oksana Kuzmina hasn't been on vacation for a long time because their medical facility is undergoing reconstruction. Good morning, dear friends. My name is Oksana Daniluk. It took me most time to find two persons. These are a person with scientific publications. That's Vladislav Dichenko, mobile app for schools. I was surprised by that, but this is the topic which is very interesting for me, the topic of education. Yes, so thank you. Who else? Whom have you found? Yes. I found Anya, and her pet is a horse called Halva. A horse named Halva. I have an answer to Oksana Daniluk. She likes reading books, and the last book she's read is Daughter. Who else? All right, then let us continue and talk about today. This is the second day of our summer school. So we are starting our work together. Then we will have 2 sessions with parallel workshops, which you should have registered for. The lists will be will hung up after this workshop. In the evening, we'll have 2 joint activities. One of those is the book club. We will have Volodymyr Stanchishin as a guest. I think that most of you have received the books. That means that you should take the books to the book club in the evening. Don't forget to do that. So this is about today. And I hope that those of you who registered for yoga and Nordic walking in the morning managed to join the group. So can anyone raise their hand if you've been to Nordic walking? Okay, Elena, could you share with us? I liked it a lot. This was my first experience of Nordic walking. It was a bit difficult, a bit not unusual, but Serhi was a very interesting person. He taught us how to do that. We had a group of newbies because there were just a couple of persons who had tried it before, but the others were, well, trying Nordic walking for the first time. Thank you for your impressions. Those who couldn't try it today can register for tomorrow or the day after tomorrow. And who visited yoga? Yes. Well, first of all, we had Olha, a great trainer who made this introduction that yoga is a combination of body and mind, and you have to do everything so that you feel comfortable. So the energy in the class was very positive, and I really recommend that you start your morning with a yoga class. Thank you. And you will be able to register for a yoga class for tomorrow or the day after tomorrow. And spa is also available, so you can go there in the morning or in the evening. I'm not going to ask you whether you've been there because I think that most of you know about this opportunity. And now it's time for us to start our first session for today. And I would like to invite Natalia. Good morning. My name is Natalia. Thank you for the introduction. I am happy to see you. I am happy to see so many familiar faces from different collaborations we've had, and I'm very happy to be here with you today and to see how active you are in working on your health, on your physical and mental health, and developing your cognitive abilities, because learning, it's about the development of cognitive abilities. So I'm very happy to be here with you today. And we will start our session today. Do you remember what it's called? I will remind you. We'll be talking about why the best public health solutions are born in collaboration. For the main idea, the red line of the school is collaboration, that together it's much easier to achieve things and to develop. I will tell you a couple of words about myself, who I am and what I'm doing here. My name is Natalia Olbatsinko. I'm a partner at One Health Agency. We are one of the implementers of the Swiss Ukrainian Project Act for Health. We are grateful to the Swiss Embassy for the opportunity to be able to implement such projects, including the summer school. We've also collaborated with MH4U and other projects, so we know what collaboration is. I've been working in communications for 20 years, more than 10 of them in public health area, because this is the area of my interest, personal and professional, of course. And in fact, my main goal is to, do something, but I cannot do something alone. I can only do something in collaboration with other people, especially when it comes to the topics of health and public health, because these are the problems which cannot be solved in a day. This is not a sprint, this is a marathon. So it's very important for people, organizations, and partners to not just declare that they are ready to do something, but also to be ready to go until the end and to achieve results. Just a couple of facts about our organization, One Health Agency. Most our projects are implemented in partnership because we don't do anything on our own. We work with the ministries, with the communities, with the heads of medical facilities, with the social service, and many others. And we know that partnership is very valuable. We can't do without it. Most projects we work with are long-term, starting from prevention of NCDs to 40-plus health screening, which we will be talking about today, and to other topics. This is a marathon, and it's a challenge to start joint work, but this is just one of the challenges. We've been working with the diabetes mellitus topic since 2011, and at the time nobody knew much about this disease in Ukraine. And this partnership was evolving and developing, and the main thing is that small steps may bring good results. And you all know that now the situation with the medications and with the understanding of this disease and how to prevent it is much better. So over the years, I found out that it's not about the number of meetings, not about the number of memoranda signed, but about the real actions we can actually implement together. It's about trust, and it's about not stopping, even if there is a misunderstanding somewhere. And this is what we would like to talk about today, and we will have great speakers who will be able to discuss this topic with today. Just for us to immerse into this world of collaboration, I would like to mention Metropolitan Andrei Sheptetsky, whom most of you should know. He's a very important person for Western Ukraine and for Ukraine in general. This is a person who was actually the driver of collaboration. And in 1901, he said that common good is the basis of any love. Common good is the basis for any love. And I was thinking about this phrase, and I read about the sermon where he mentioned that. So I was thinking about it, and I thought that this common good is the basis for a good partnership. When we recognize that a joint goal is more important than the interest of each of us separately than our personal interests and needs. And that is where love is born. So let us try to disassemble it into the elements today. So what is the framework of our discussion today? We'll be talking about the three topics. There's road safety, an important topic, also vaccination, and our favorite one, 40-plus health screening. I think you'll like this topic as well. So something has been done in each of these areas, but these are the long-term projects because they are the projects in the public health sector. No, none of these projects is over yet. We can't say we have great road safety, we have 100% vaccination rate, and so on. So since we are in a school today, so our goal is to build on those decisions and to help develop them. We'll have three speakers who will be talking about their coalitions, partnerships, and so on, but there are also many things that have not been done yet. So together we will try to, think about what else can be done in this area, because we have a very good circle of like-minded people here. The rules of collaborative thinking, we are not criticizing, we are supplementing and adding. We are not repeating because we don't have enough time for that. We will be only adding the things that have not been voiced yet. And the third thing is that we are talking not only about the things that the others should do, but what we can actually do to make sure that the story is a success. And the logic of discussion is the following: whom to involve, who to communicate with, and what should be the responsibility and what should be the action. So it's like at a school. Well, we are at a summer school, so I hope it will be fun as well. Our speakers, who are professionals in these areas, will give us feedback on what suggestions of yours may be useful to them. If you are okay with this format, then give us a round of applause, please, to, well, shake everyone up. And we are talking about public health, about challenges, and in addition to the three ones I mentioned, there are many others. So I would like us to get immersed into a broader world of public health and the challenges the public health in Ukraine and in the world is facing and what is actually working there. And I would like to give the floor to Volodymyr Kurpita. He's the Director General of Ukrainian Public Health Center, national expert in the area of public health. He has the experience of implementing national, international projects and programs, and he also has a PhD. And Volodymyr will have a bit more time, and then we will be working in the Pachakucha format, 10 minutes for presentation of, a project, and then the discussion of the project. I don't have a presentation, so you will have to listen to me and look at me, not at my slides. I tried. I wanted to actually bring you back to that old school format when we studied at the universities, when the professor would just come, to the front of the room and start explaining something without having any visuals. So I'm the Director General of the Ukrainian Public Health Center of the Ministry of Healthcare of Ukraine. I know that we have a mixed audience here. Well, who knows what Public Health Center is? Oh, it looks nice. Okay, very good. I have an honor to, so to say, set the tone of this discussion today. So I will try to tell you about my reflections on the global challenges public health is facing now, and then we will proceed to discuss more Ukraine-specific things and the things that can be done in Ukraine. Looking at today, I guess each of us feels two most important things today. First one is uncertainty about future, and the second one is certain apprehension and the pain and grief because of the losses we are suffering. And sometimes it feels, especially right now, we feel like the world is unstable, unjust, and unpredictable. And we have to recognize that the world is really in a very complicated condition, and we can say that this is even a kind of a breaking point. And if we wanted to make some hasty, conclusions, we could say that there's no way out and become very pessimistic. But this would make us refuse from the responsibility and the commitments we have undertaken before ourselves, our families, our communities, our country, and our world. The history itself knows many examples of such global challenges which existed in the past, and there is no doubt that our challenges are just ones in a chain. They are not unique. They're just one of the next challenges humanity is facing. So I suggest that we look back and think about the lessons humanity has learned from the previous challenges. And one of the most important lessons is that you should never lose hope, because hope is what lets us look into the future.
This hope shapes the responsibility of leadership, also the responsibility that we have with our expertise and institutional power as well. This responsibility is us staying on the right path, but at the same time suggesting something new. That is exactly why we focus on collaboration and joint activities. I know that I started with a little bit of a pessimistic note, and we know that this is what reflects the Ukrainian community, but it's really important that we finish on a positive note and that there is hope there. Today, we focus on resilience, and I was trying to think what is my understanding of resilience, especially from the perspective of public health. In my understanding, resilience is, generally speaking, the ability of community, institutions, society to continue performing critical functions at the same time adjusting to the circumstances, learning in times of crisis. But what is most important, not to lose faith and hope. In essence, we understand that public health is one of the key infrastructure which helps us to sustain our resilience. It's something that works not only through healthcare facilities or standards or guidelines. It's about our ability to agree on new rules, to find a consensus, to be aware of the risks that we face, to act concertedly and to support each other when we address all of these issues facing us. That is why this discussion is very timely and it is so much needed in this time. I believe that in the past, all the critical challenges we faced were connected with the one way setting of rules. I will elaborate on this idea further. Or another case was when we have an emergency or when we communicate with great numbers of people, and that was some abstract cohort of population, but we understand that it doesn't suffice for the current reality. We really need to transform our solutions. That is why I'm convinced that in times of the crisis, the most important and the decisive thing is not when we have some formal capacity or authorities as an institution. It's about the trust that people have towards this institution, whether people can act together without some prior lengthy discussions and agreements. Also, it is about the rules imposed by the state, how flexible they are in local context, and also whether the system can learn faster given the nature of the changes of threats that we are facing. To answer these philosophical questions, I decided to take some notes and to have three key transitions to a new model or to new approaches in public health sector. Historically, public health had been formed as a system of norms, some commitments, and also sanitary control or oversight that was part of the state function. Experts, well, it started with the experts, then the state determined the criteria for water, where we should have some treatment facilities, schools functioning, what kind of diseases we discuss publicly and what we do not discuss publicly. So the logic was the follows: the experts know all these rules, then the state follows these rules, but not always. It depends. And when it comes to the public, they really need to follow these rules strictly. And of course, we understand why sometimes this logic really worked, because sometimes there was no access to verified information, knowledge, there was some ignorance amongst people. That is why it was not so easy to dispel some myths or dangerous practices, and it was through the authority of doctors or public officials that you could do that, because there was trust, or actually, it was not always about trust. Sometimes you were just scared. That's why you followed the rules. We understand that now it's possible for us to keep everything under control when it comes to some diseases such as cholera or plague. Well, smoking, we believe that we have some control over it as well. We have uh, infectious infection control, and many other things. But the question is not whether we need these rules. Of course, we need these regulations. However, the question is whether it is enough for us just to have this rule and to inform society about that. But we know that these days people are no longer passive receivers of some instructions. We have access to hundreds of different sources of information, because I think that in the past we would have 150 contacts, but now I think that it's over 1 month, not throughout the life, that we have access from different channels of information exceeding 150 per month. We interact with the state, with community, with our family. We have many interactions. That is why we really need to be frank that on the one hand, seemingly it raises awareness because we have more information and more access. However, somehow it turned out that this is not a guarantee that you will have evidence-based decision making at the end of the day. And this is actually that we could clearly see when the pandemic hit, because this formal declaration of rules did not work. They were changed without justification and explanation, when these decisions were not deemed as fair, when the state required people abiding by these rules, but there were no conditions provided for that. And it was only when the decision was taken that the communication started. I think that now we really need to transition from people following the recommendations to focusing on creation of conditions when this type of decision becomes understandable and logical for people and acceptable, which is even more important. Because whenever we set some rules, there is no automatic trust from people. You really need each time to prove the transparency, to show that you're competent, to show this connection with people. This is a major topic, and I think that this is something that works not only in the domain of public health. I think that it works for different other areas, armed forces, uh, politics, many other things. It's really important that we have the institutions for the state, but the institutions also need to be flexible, not only imposing something on people. Another point that I would like to dwell on, well, the way I shaped is from heroic response to systemic resilience. Ukraine currently is a laboratory for resilience, but unfortunately, our experience is not recorded to the extent needed, because all these solutions that were created before, they were for peaceful time and they were implemented in peaceful times. They meant that you have some stable territory, and there we can have, well, some kind of surveillance. We can make observations. It was about, well, quite a well-developed system of healthcare system. We have patient pathways elaborated and so on and so forth. And the most important thing was resource planning that you can do ahead of time, long-term vision for a couple of years to come on the basis of the experience that we acquired in the past. But unfortunately, when the war begins, all of that stops working. That is why it is critical for us to showcase our experience and to show that as a separate type of functioning of public health. Global models do not have sufficient evidence for this yet, but the Ukrainian system has been functioning thanks to incredible efforts of individuals. However, this heroic stance of individuals cannot become a permanent governance model. The system cannot be kept stable and sustainable because people work with no rest. We understand that resilience is something that helps to work for many years. That is why this true, authentic resilience has to be described, recorded, and transformed into new rules. Ukraine has this unique practical experience. However, it is something that separate individuals carry maybe in your internal communications only. Very often, we try to record different events and to make sure that this information is kept, but I see very few materials where we find information about a decision making process and how these decisions are taken, what was the context factored in, what kind of alternatives were considered, if any, because we speak about an emergency. What worked, what didn't work, what was the role of cooperation, and whether we can replicate this decision and use the same approach in a different region or in a different country. If we do not systematize this experience, the world will know some random stories about Ukrainian heroism and Ukrainian resilience, but they will not know about the Ukrainian model of resilience in public health sector, and it will not be possible to use it in the future. That is why the practice of recording of our experience should be part of our routine, our everyday routine, not when the war is over, not when the crisis is already behind us, but it's important to do it now when we understand the essence of these decisions, when we are fully immersed into the context for these decisions to be made, and when we have some plausible mechanisms working for the system to ensure its sustainability and resilience. We understand that joint activities, these collaboration is not only about joint meetings. It means that there is some joint understanding of what the risk is. People also understand their function, their responsibility. They can also rely on each other thanks to horizontal connections, not waiting for something to land on them. They also have agreed mechanisms of such cooperation, and they know how to take these decisions without excessive centralization. That is exactly why we can say that real systems are not formed thanks to a single administrative plan, but thanks to the uh, collaboration of different institutions. And it's so important to have evidence based materials collected and to have all of this information recorded. Also, we need to focus on the new quality of communications because we communicate using the categories of the past, unfortunately. In public health, we speak a lot about target groups, target audiences, and of course, they are important from the perspective of planning, but given the large scale nature of behavior change, we cannot really play it because if we take two people from the same area, the same age, they could have a totally different reason for not getting vaccinated, not following doctor's recommendations. For some people, it is about side effects. That's why they're resistant. Some people don't know where to receive the service. The third person doesn't have time. Another person does not consider it of any significance or relevance. We also have modern digital platforms. Yes, I mentioned it in the beginning that I will be a very boring presenter, professor like. But of course, we understand that it's very important to address an individual, not to address a target group. However, for public health, very often we have one campaign launch, we use the institutional language. It's not about the needs of a single individual. That is why we are losing in this communication. It's really important for us to focus on personalized algorithms of social media because we focus on universal approaches. We need to communicate a lot using social media, not to be afraid of that. Because, well, let's take a look at bloggers. They say stupid things sometimes, but they strongly believe in what they say, and people listen to them. But somehow you feel embarrassed and shy because you say that, well, it's not serious, but you've got to say. Of course, you cannot convince a person to seek support if the system is not ready to provide the type of support needed. You cannot build trust to vaccination if people don't understand where they can actually be vaccinated. We really need to use simple, user friendly language. You cannot create trust in times of crisis and times of war. It's a process, a gradual process, but well, we are not we don't have the luxury of time, and we understand how timely it is to do it now despite the circumstances. Last but not least, resilience does not start when we have an ideal plan for all possible crises. It starts when we have people, communities, institutions have connections, and they keep working even when you have already exploited all the resources that you have. I think that the key question here for this summer school is how to transform cooperation from a set of separate partnerships and to transform it into a sustainable, resilient ecosystem for the benefit of Ukraine. I'm sorry, I was not very brief, yeah, but I still liked it. I think that, yes, do you have, as far as I understand, do you have some notebooks, some workbooks for reflections? Yes, you do. Okay. So you can use them now because this is an important topic and we will proceed to other topics. That means that not everything will be recorded. That is why I will ask you to note down something that you found really relatable. Insight, yes, as they say in English. Try to write down what was the insight that you received after the presentation of Volodymyr, something that resonated with you or something that frustrated you. That is also okay. I think that I felt this dynamic of discussion, when people reacted when he started talking about communication. So I could actually see some reaction from you because Volodymyr mentioned about social media and bloggers, and we know how it works in this field of information sharing. It's important for us to stick to some framework, to follow guidelines, rules. But we also know that there are some other people. They do not always have something meaningful to share, but people still listen to them. So let's take a minute, put down something that you find relatable, something that resonated with you, and then we will continue this discussion. Another vital thing that Volodymyr mentioned was having records, putting something on record, actually documenting it. But it starts with reflections. It's not only about something that you do by default. We understand that if it's about documenting something, we really need to have some information collected, but it starts with understanding why we do that, what is what is the outcome that we want to attain. And we understand that this is something that is taught globally at school, and that is something that we do not have. So it's not about these automatic things that we do, but it's about a skill of reflecting, writing essays. But for us, it was different. Learn something by heart. It's great. It's great for memory training. Learn a poetry, learn a formula, learn something else. But reflection is so important. It means that you can have a critical approach towards different topic and you can be present. I hope that you jotted down something that you find of importance to you. And as I already mentioned, we have 3 cases, 7 minutes for a case, and then we will discuss it together. We will think in what way we can complement the cases. We will start with the topic which just seemingly is not related to public health, traffic rules, right? It's about speed, pedestrians, drivers. But we understand that actually it is so important from the perspective of public health. This is part of what public health does. It's not only about the state and rules, it's about all of us. That is why it is such a critical topic for us. Olas Zakholopik, the director of the Center for Democracy and Rule of Law, is invited to the floor, and she will tell us more about the importance of traffic rules. She's a lawyer, she's a coordinator, a speaker at many educational initiatives. She's an expert on improving cooperation between different NGOs in this field. Urban Mobility Initiative awarded her with the Mobilized Women Award for this topic. Exactly, it's about empowerment of women. And also, she is in the Remarkable Feminist Voices in Transport edition. It's about the role of women in the development of transport uh, realm. So, Alessa, over to you now. Please listen attentively because we will add more to it.
Мікро.
Take the microphone. The microphone doesn't work. Good morning, everyone. I'm very happy to see you, both the familiar faces and those whom I don't know yet, but I hope you will actually, we will get acquainted. So when we speak about public health, people think about vaccination, about disease prevention, mental health, but few people associate it with road safety. But it's a component of public health. And when we speak about road safety and the problems that exist in this area, for me, it is associated with a kind of an epidemic. So speaking with the language of figures, in 2025, more than 3,200 people died on the roads in Ukraine, and approximately 32,000 were injured. But in fact, these numbers are even higher because the statistic doesn't reflect how many people died of the injuries within 30 days after, well, they got this injuries. And every second deadly accident is caused by speeding. And paradoxically, when you speak about the speed, that it's a problem, people kind of understand that. WHO says that this is the key risk factor impacting road safety. All over the world, speed is the reason number one for deaths on the road. There are stories of families who lost someone because of the speed, but at the same time, the society doesn't view speed as a problem because it's an element of comfort. I'm a good driver. I can quickly get from point A to point B. We never feel it's a problem. There's always somebody else to blame if there is an accident. But the realization that speeding is the reason exists very rarely. And there are many explanations for that because there are, well, some elements which cause this perception. These are the laws and infrastructure, and also lack of awareness raising. When we talk about the laws, we have a system of responsibility for traffic violations, and we have two different, well, punishments. So if you speed by 20 kilometers, you pay 340 hryvnias of a fine. If it's you speed more than 50 kilometers, it's 1,700 hryvnias. But if you are fined, if you pay the fine quickly, you can well, get a 50% discount. So this is a kind of a, well, subscription, well, or a bonus for speeding. And then there's also this margin, like plus 20. So well, if the limit is 50 and I'm driving like 69, you will not be fined. And that actually means that people use this plus 20 margin. So this exists only in Ukraine and in the aggressor country, and no other European countries actually have this. Another thing is that you can violate once, 2 times, 10 times, 15 times, and there's nothing. You just pay a fine and you keep violating the rule. And then I can see videos on the threads where a woman posts a picture and says, "This is my third try to have a good picture from the road traffic camera," because it's not expensive. It's like 170 hryvnias for her. And then it's also the infrastructure, which lets you move. So this is about the importance of the problem. I've been working in the road safety area for more than 10 years, and we've been working on the changes in the state policy, that means legislation. So together with the colleagues, we joined our efforts and signed different manifests. In 2024, almost 40 organizations initiated actually this the manifesto for safe roads, and one of the elements here is amending the legislation in the part of speed limits, and we've been working a lot on actually initiating a law to be at least registered at the parliament. And in 2025, one member of the parliament actually gathered his courage and submitted this law, and it was registered, but it was not discussed after that. Members of the parliament don't want to work with this topic because it's not popular, it's not convenient. So the draft law and some other initiatives were registered in 2025, but no progress has been achieved. And in June this year, a critical event took place, and it actually made the problem more in the focus. There was an accident in Karavayevi Dacha in Kyiv, and well, there were 4 people who died, including a child, a boy Hrisha, who was the son of a war veteran. So he actually killed people in the underground pedestrian crossing. People died immediately, including 2 police officers and a kindergarten teacher. And after that, there were many discussions of this topic, and we actually published a post saying we need changes. There is already a draft law. This driver violated traffic rules 39 times within the last year, and he was a taxi driver. So the system basically legalizes behavior like that. We in our expert environment, we realized that we need to make pressure on the parliament. So we intended to have a petition and use other tools, and the community of the parents of the Waldorf school where Grisha learned, and they said that the parents want to send a petition to the president. So we got acquainted, and these parents who lost their child, these are incredible people, very brave people. On the second day after the burial of their son, they held a press conference where the father started demanding changes from the state, that you cannot let systemic violators drive on the streets and remain unpunished. We also participated in that press conference. We wanted to present that petition. That was on a Thursday, basically next week after the accident. The petition was declined, but this was also a reason to share information broader. We had 2 more attempts. We amended the text, and then the petition was finally registered. Just the last comment from me. So the government of Prime Minister Sverdenko said that they will be working on the legislation, and at the end of June, a draft law on speed limits was adopted, and the parents were also making pressure to register an alternative draft law so that it punishes not only speeding but also deprives systemic violators of the right to drive vehicles. This draft law was declined, but they approved the main ones, and now the parents and the community are actually working together so that the new draft law gets into the parliament in September and it can be improved on and worked on. So there's a lot of media coverage of this topic right now. So, well, to be briefly, we are working on the document so that some amendments are included and it is approved and adopted by the parliament. All right. One question, and then we start discussing the improvements. I'm Oksana Karbovska. Good morning. I'm a driver with a lot of experience, and I can drive not only the car and a bike. I have driven throughout the Asia and Europe. And I think that you're missing an important opinion, that you have to communicate not only with the parents and the victims of accidents, but you need to work with the drivers as well, because we as drivers also have our own opinion. So, for example, I'm driving on a highway where people should not be walking, and then somebody is just trying to cross this highway at that time. I cannot do anything about that person. So I think we have to communicate with everyone. Am I listening, or can I comment on that as well? Well, we work with different audiences. It's just a case, an example where we joined our efforts to introduce amendment into the legislation to show that this is not just a problem for the activists, but for people in general. And I do agree with you. So this is also about the design of the infrastructure, so that a person cannot actually, be somewhere on the highway there. Well, do you remember the rules? Okay. Please take a seat. This is important. I'm also a driver. I have just driven from Lviv and from Kyiv, and I was, very excited about that. How do I defend my rights as a driver and so on? So we will be working in the following way. So I wanted to ask a question first. So whose resource or impact or trust is not used enough to make sure that the behavior on the roads is a social norm? And I'm talking here not only about the drivers, but also about pedestrians. And I also asked Olasa, the scooter drivers, because I'm very stressed by their presence on the roads. But we decided that we will be talking about speeding because I'm a driver. So I'm trying to raise the issues which are important for me. So an important insight when it comes to this case, and you please think about what could be added here in this respect. There's a tragedy which took place, and the parents undertook the leadership. So it's not simply grieving, it's thinking of how to change the system so cases like that don't happen again. I think it's a very important insight that someone has to be a leader here and to undertake this leadership roles, and then everyone else got involved, like the president and Prime Minister Sverdenko started talking about the problem as if they didn't know about the existence of this problem before that. So, question number one, influence, resource, trust. Whom else should we involve? Whom else to communicate with, so that we make sure that this draft law doesn't get lost, but so that it is worked on by the parliament in September. I see Volodymyr is very skeptical about that, but let's think about it. Members of the parliament. So what do we do with them? They have been talking to them for 5 years, but members of the parliament also are also drivers. So you will go to the members of the parliament and you will demand that. What else can be done here? Let's think about the format. Please raise your hands. I will give you the microphone. Yes, of course, we have to talk with the members of the parliament, but we should probably talk not to the members of the parliament themselves, but to their families. They all have cars, they drive, they have parents, wives, children. Maybe the family will persuade members of the parliament that this should be done. How do we communicate with the families? What do you think? How do we communicate with them? Well, just catch them in the street when they are walking back home? Well, I don't know yet. I haven't thought about it yet, but this is just an idea. Advertising and at schools. Do you mean like putting up posters there? I think we should add also fines for pedestrians. And then the drivers will be more interested in that draft law. So we need to, well, popularize that. We need to show that it does exist because, the drivers are always to blame because we all live in a society and we have one road. If we are going to Europe, like yesterday, I needed to get from Rivne to Truskavec. I I would happily pay for a paid highway and not go through the villages because the only roads we have go through the villages, and I will be to blame if something happens, not the pedestrian who decided that they need to cross the road here and now, regardless of the traffic. So, uh, uh, yesterday I paid a fine of 170 hryvnias. So this is what we started from today. All right, so this is fining not only the drivers, and we need to communicate that as well. I think that there have to be parallel processes. The public has to make pressure for the law to be adopted. This is about communication on all possible levels, posters, social media, all possible ways. But I'm also thinking about the supervisory bodies and the controlling bodies, which do not always pay attention, like police, for example. They don't pay attention to the violations by pedestrians, by bikers, scooter drivers, and car drivers. But that results in the fatal consequences. So these controlling bodies have to be controlled as well. All right, I need to put that down. And who's going to control them? Public Health Center. So we can add new functions to your list. I would like to add my reflection here. I'm Ludmila, I'm from Rivne. The thing is that we can support this draft law and it will be adopted, and we can have another 15 draft laws. In 2017, I went to Germany for an internship, and what was the conclusion I made about the laws? So, why is Germany so right? We usually say that practices of the European Union, of Germany, of Poland, the law here is has no gaps. Everything is covered. Everyone is responsible for everything. But our legislation has so many gaps that anyone could slip through. And you can do anything. What do you recommend? What I recommend is. That just as the previous speaker said, that there has to be responsibility of police, of all other bodies, clear structure of punishment, clear definitions. So the laws we have to be active. And if there is a pedestrian who is crossing the road, well, in front of your car, in the place where they shouldn't be crossing, and we need to make sure that this person is fined. And then these scooters we have right now. So now this is another danger on the road. Yes, thank you. I've heard you. This is important. Who drove in other countries? How to drive in Ukraine? And then you cross the border, and then you start looking at the road signs 40, 50. Do you violate traffic rules in Poland, for example? Why is it so? Why do we drive according to the rules when we leave Ukraine? Because we think that they have big fines. We feel that we don't want to have problems with their police. And in Ukraine, we can solve anything. So this is a very important topic, but we have to start discussing the next topic, vaccination.
Давайте стоп.
Okay, so probably we will make a pause here because there is a critical moment. It's so important that we also set an example. Yes, I think it's very important to focus on children, kindergarten, schools, universities. Do you have this culture for pedestrians, drivers, attitude? Because as you rightly said, it's part of our perception and part of our mindset that you can do that in Ukraine, but you do not violate these regulations abroad. And we really need to teach our children that no, you do not break the rules here, you do not break the rules elsewhere. It's important that you abide by these rules, and that is the only way because there are no exceptions and no alternatives. And Volodymyr, last but not least, about the system approach. Yes, I'm also a driver, of course, but yeah, well, okay, most of us are drivers. You speak a lot about breaking of traffic rules by pedestrians. However, I would like to focus on another thing. We do not really have statistics to reflect the situation. So if we take a look, we will see that pedestrians do not really violate the rules of often. Mostly these are drivers who are responsible for these violations. I understand that we can have thousands of stories. All of us have thousands of them, but the system doesn't really record these violations if they are committed by pedestrians. Well, we don't really have the system. That is why we have this impression that there are so many violations by pedestrians. That is the first thing. And secondly, we understand that this is such a deep issue. It is tightly connected to the infrastructure. And that is why it's up to the communities. It is part of their road infrastructure. I think that it's really important to have some good practices. Do you have some limitations? And I know that drivers do not always like these limitations, but it's an easy solution. It doesn't require any legislation to use a speed bump. I also mentioned Koretsky, Olesa knows probably about this, that whenever we have the change of the government, all those bills which were proposed by the government are not valid anymore, and then you need to undergo another process of submission of these laws. Yes, absolutely. Also, you can use these some kind of bypasses basically, and yes, there are some physical hurdles. That's why you can also use these traffic circles when you enter the community. There are many alternatives, many options, so feel free to address Olasa. You can also have more discussions. Another important topic for public health is vaccination. So who does not support vaccination? I see. That's, yes, that's a good sign because it speaks a lot about the selection of participants for this event if somebody said that they're against. So Serhiy Zavadsky, the head of the Coalition for Vaccination NGO, who will tell us more about partnerships and how they help the coalition to make a change as far as this subject matter is concerned. And we will also try to think together and brainstorm what else we can do because it is such a major topic for us. Thank you. I would like to welcome everyone. I prepared the slides. I don't really know whether you have the presentation. Yes, it's already on the screen. I see it. Thank you. The state can procure vaccines, but without the trust of the public, they can be stored at warehouses and not to be really helpful. That is exactly why we decided to establish the Coalition for Vaccination. This is a platform which unites the state, healthcare professionals, educators, civil society as well. And I would like to speak briefly about joint activities and how they helped us to overcome some concrete challenges. What are the results? What is something we have not accomplished yet? And we will share more about lessons learned. So, briefly about our organization, about NGO. I'm just trying to figure out how to advance the slides. Yes, it's there. So, I will try to be concise. So, since 2021, the coalition unites 79 organizations. These are public organizations, educators, civil society organizations, healthcare professionals. All of us aim at one goal, to have access to vaccination of everyone with no discrimination whatsoever. So we have a memoranda signed with the Ministry of Health, Public Health Center, regional public health centers. We implemented our 20 projects to support vaccination campaigns. We also participated in the development of national and regional immunization strategy. So yes, so probably it's me doing something wrong, but I guess it's fine now. The tools that we employ, people and partnerships, are the most important for us. We have the movement of agents of change for vaccination, opinion leaders, people who advocate for vaccination at the level of their communities, uh, urban as well. Also, there is the initiative at the Youth Council, supported by the Ministry of Health, the Ambassadors of Health. Over 300 educational institutions participated in the week of immunization of 2026. We organized different trainings, forums, at which activists, doctors, public officials try to develop joint solutions, and it's really important for us to have these tools. We also have the national portal for immunization, chatbot platform for parents. We also have training as part of continuous professional development. Over 12,000 healthcare professionals participate in this training. We also use the system of dashboards of the National Health Service of Ukraine. And we also cooperate with public health centers and their elaborations. The crisis of trust, that is the first case to discuss. I think that many of you know about this period. So we had this crisis in 2015, 2018. We had the lowest rate of immunization in Europe. There was a gap when it came to procurement, so there was a scarcity of vaccines, a lack of communication, and we also had very many myths about the harm that vaccines could do, which impacted people heavily. But thanks to the effort of UNICEF, the World Health Organization, we also had large-scale procurement. We also had awareness raising and information campaign. We also had different advocacy projects of civil society. The outcome was that we have the coverage for measles vaccination from 21%, we already had almost 68%. So this is not ideal. Then we also had indicators improving for whooping cough, diphtheria, and tetanus vaccination. The second case, Equal access is one of the topics for the discussion that I would like to have today. Yes, now we have the slides back. In remote rural areas, in many cases, we do not have healthcare facilities. Physically, there is no place where you can get vaccinated. So that meant that you really need to make sure that there is access to vaccines and that you organize it on site. The coalition participates in national campaigns to catch up with vaccination for, well, measles, polio, and we have 153,000 children receiving vaccination against measles in 2023. We had 5 outbreaks localized. We had 106 settlements covered in 8 regions when we had on site visits of doctors. Also, a new schedule for vaccination that we have, it's been updated. This is a great example of advocacy and joint efforts. The experts from the coalition participated in drafting and implementation. We are very active during the implementation phase for the schedule of inoculation jointly with the state as well as our international partners. What else is important? And what else we have managed to achieve? We have trust back. We also managed to deal with outbreaks. We have an updated schedule for vaccination. Also, we use the statistics and it became a working tool for physicians, for politicians. What we have not achieved yet, we do not have equal access to vaccination. It depends on our planning capacity for on site visits. The coverage is over 15% for the first year. But of course, that we need to work more on that. Also, it's important for us to have better not to compete, but to join our efforts. We have 79 members. We do not compete for resources. We try to apply efforts together. It's important to strengthen the state, not to repeat what the state has been doing already. And of course, trust is built on stats and on explanations. All of you who would like to join our initiative and to become vaccination agents, of course, we are open to this cooperation. Thank you, Serhii. Thank you for respecting the time allocated for your presentation. And I have a question here. What kind of conversation are we lacking, and who has to start this conversation? Yes, I think that we already had a hand raised, but make sure that you introduce yourself for us to know more about you. I'm Lina. I am from Kyiv. It's not so much of a comment, it's more of a question because, yes, we have such cases when something goes wrong and, well, a child usually, yes, it's more about children, they could get sick. It's 1 per 1,000 of population, but it becomes a high profile case and that results in people not trusting vaccination. Are there any tests that you can do before you get vaccinated, whether it's okay for this person to receive vaccination? It's not my case, but it's about my niece. So she was constantly vaccinated, and I have many children. There are many children in my family, but for this child, whenever she was vaccinated, there was always something wrong. So she would get sick, and it was really terrible. And I still don't really know because, I will have grandchildren in the future. So how do you check? And do you have any information about this issue? This is not about probably it's not only the question to the Coalition for Vaccination NGO. Maybe Ihor, would you like to speak on that? There are no tests that you can take, there are no lab tests that would show you that this specific vaccine could result in something. There are other tools, and the state has these tools. It's about tracking, monitoring of these cases, and probably then acting upon these cases and changing something. But if the Stavny knows about such tasks, feel free to share this knowledge with us, because I personally do not know about these tests. Do we have such tests? To the best of my knowledge, we don't. We have a family doctor who says that we don't have them and we don't need them. I think what's important is to have an honest conversation, because if we have an honest conversation, and you know how it works in our state, and it's not only about Ukraine, you're always afraid to speak about that. Yes, that it's not side effects. What do you call it? We do not have this culture of discussing what can potentially go wrong after the vaccination, these adverse events following immunization. And sometimes people don't really know whether it was a coincidence or it was something related to immunization. And yes, we do not have the test. We have already clarified that. I'm Valeria. I think that what we are lacking for this conversation in Ukraine, and it's 2026, so it's great that we already finally have HPV vaccination, but it's free only for 12-18 age group, and we know that for women who are already 40, they need 3 doses, and 1 dose costs 6,000 hryvnias. And it's a little bit upsetting, of course, because for women, younger women, it can be not so expensive. AIDS immunization, I don't really remember about the country, but I think that they have already started developing vaccine, and for 6 months you don't need to take meds on a regular basis. Also autoimmune diseases. So, but I had a different question, because yes, you're saying more about, but you know that with HPV only have 15% coverage, as the speaker has mentioned. I would like to provide an answer to the question for vaccination of women and these categories which are not part of the order regulating the group for immunization. Back in 2018, when we just started thinking about HPV, but in 2019, Zhytomyr region, our community used this vaccine for the age group of 9-15 years. And that means that it's important that you discuss it with community members, with local counselors, and they can actually use their local budgets. It's about the prolonged effect, and in 20-30 years you will have it. And if local counselors listen to you and heed your advice, that women who are part of this category under risk can benefit from it. And this is not a lot of money, actually. And I will be honest with you, there will be not so many people willing to receive vaccination, because we have boys also vaccinated. I use the principle that we ordered something and we received, and we have 30 people vaccinated out of 10,000 with whom I have the declaration in my community. This is such an active audience that we have today. I am Yulia. I represent Kozyatan community family doctor. I would like to support Victoria, because in our community we also have a program. It was before the state initiated the nationwide program. We procure Cervarix, which was more accessible, and we have over 400 girls vaccinated, and now they can also use Gardasil, uh, the most common vaccine. So they have already been vaccinated. They did not enter the statistics, and we really need to find a solution here. It is also important, actually, it's important to discuss it.
Все потім до вас.
I'll go there and then return to you, and then we will finish because we have one more very important topic, the 40 plus health screening. My name is Daria. I'm from Kyiv. I'm a mother of a teenager vaccinated against HPV. And I have a question about vaccination of the service people because they are in the risk area, tetanus, pneumococcus, meningococcus, and even COVID. We don't hear anything about asking people whether they have a medical certificate. My husband is fighting, and well, during the medical screening medical commission, they are not asked to provide the vaccination certificates, and nobody's talking about a vaccination of the military. But this is the group of people who really needs to be vaccinated, and they can be localized. In fact, that's an important comment. All right, here and then there, and then we finish. My name is Anna. I'm from Dnipro. Concerning what is lacking is psychoeducation of parents concerning destigmatization of vaccination. From what I've heard from a friend and from our colleague who was the first to speak, this is the lack of awareness about the advantages and risks of vaccines. What do parents feel when they don't know something? They feel anxious. They feel a kind of a crisis. And then the child feels that as well, and then and psychosomatics works there as well then, and parents think this is all because of the vaccination. So we need to destroy the fears because, well, through destigmatization, we need to reduce stigma because parents know that vaccination saves lives. Who should do that? Why not coalition? Why not the union? Why not NGOs? Working with that. We have enough information campaigns among the doctors, but a doctor has 15 minutes for a visit of a patient. It's not enough for awareness-raising campaign, and it's also important to talk about it in responsible parenting schools for pregnant women, because that's the time when they can actually listen about those things. Yes, thank you. I have to go there. Victoria, I feel asked Women Against Cancer. I don't think everyone here knows that there's a very nice tool of collaboration which helps procure, well, in our case, Gardasil vaccine. These are the agreements which work at the regional level. That's when the state procures Gardasil at a special price, and also the regions can produce it at the same price. It's much cheaper than it used to be, so this tool should be used, and then you can provide more people with vaccines. Yes, thank you. I'm coming here, and then we'll have to finish because we have one more topic to discuss. Good morning, I'm Oksana Fizik from Kyiv. I'm an owner of a small private medical facility. We are vaccinating our patients very actively, and a month ago we were informed that private medical facilities will have no right to get the vaccines provided to the state through humanitarian routes. We are talking here about collaboration, about equality, so I would like to hear a comment whether this will be solved in any way, or will this mean that we will not have these vaccines, although private medical facilities play a big role because we work with the National Health Service, and that actually helped improve the quality of medical services in the state-owned facilities as well because they're trying to compete. So are you going to work on these matters or not? I think Serhiy made a note to himself. And in fact, the loyalty to vaccination is shaped by private facilities as well. All right, so you're the last one, and then we will proceed to the next topic. Thank you. So I would like to stress many things you have already mentioned. I'm a family doctor. But you know, there's a thing I would like to focus on a lot. First one, this is the vaccination of the military. I would like to add the hepatitis B. And rabbis here as well. We've been talking about that a lot at the ministry, and I know how many people will treat this question, but I think it's an important matter. And then also the communication matters. I'm for well, I'm a proponent of the idea that all vaccines have to be paid for from the taxpayers' money, but this is not possible in Ukraine. And then I would like to ask you to think about how do you communicate about the vaccination of additional vaccines? Do you communicate it to people enough? Because I live in a city where a beauty salon and alcohol store open once a month. Every month. You know how much alcohol costs, and you know how much different beauty procedures cost. So the question is, can these people actually afford being vaccinated against HPV or something else? But what I see in the advertisements of the medical centers is that there are mandatory vaccines and optional ones. And my patients come to me and say, you know, but I don't have to vaccinate against this disease. So think about how you communicate this, because there are many people who can actually afford it. Those are not optional vaccines. It's just that the ones are paid for from the taxpayers' money, and the ones which are not paid for from taxpayers' money. But all of them are recommended. Just some of them I paid for, but by taxpayers' money, and the others are not paid for. Well, think about how you communicate it. That may solve a lot of problems as well. Thank you. We're coming back to the matter of communication again, and Ihor has answered most of these questions, and I agree with him. But I would like to go back to what to the other our side. So we need to communicate. Well, these things at school as well, but we have so many teachers who do not believe in vaccination. We need also the village head who has to talk about vaccination, a city mayor who has to talk about vaccination. There are very few mayors who speak about vaccination in general, because this is not well, very convenient for them for political matters, but also communication through social media. And I can actually see many anti-vaxxers on social media, but very few of those who actually are pro-vaccines. So I think that we need to launch this campaign among individual bloggers and start developing this communication. I'm not going to speak much more about the vaccination against HPV. And now when we speak about HIV, this is not a vaccine. This is medication, a medication for pre-contact prophylaxis. It is, well, actually prescribed to those who are not vaccinated yet. So it will be available in Ukraine from November, and it will be used for people in the top risk groups. It will not be available to everyone because if the risk is low, there's no point prescribing you this medication. And the third question about the service people, it's a very serious question, because at the moment there's a joint decree of the Ministry of Healthcare and Ministry of Defense which allows to actually vaccinate the military in civilian hospitals. This is encouraged. But at the moment, there is no obligation for them to be vaccinated against hepatitis B. But when it comes to diphtheria and tetanus, this is a standard protocol which well, pertains to all citizens. Doing repeated vaccination every 10 years. What concerns rabbis, there's new standard which allows for pre-contact vaccination, so not after the contact, but before that. But it's all about money, and not only money, but also the possibilities of the industry to produce that amount of vaccines. The same goes about HPV. We can talk about it as much as we want, but the company producing vaccines also has limited capacities, and it produces a certain amount of these vaccines. And what about not giving the vaccines to private facilities? Well, yes, there is really a collision with the humanitarian legislation. When the humanitarian legislation was updated, they forgot that the law on financial medical guarantees presupposes the involvement of private facilities. We know about this problem, and we are now actively working with the Ministry of Social Policy, and I hope that in about 2 weeks we will have a positive decision and a positive solution of this problem. All right, thank you. And our next topic, we will have to exceed the timing. I apologize. We need some 10 plus minutes. And we are finishing with the topic, which is also very important. Not everybody agrees with that. Not everybody supports that. But I think that, these are different topics, as Ihor told me. So prevention is one, early detection is a different one, and there's primary and secondary prevention. And you know that the 40 plus health screening program was launched recently. It's very complicated, but we have quite good results already. More than 400,000 people have already participated in the program, and we can see interesting results of how many cases of cardiovascular diseases and diabetes have been detected for the first time. And I would like to invite Natalia Horeva, who will speak about the experience of the Kanyev Center for Primary Medical Care. And she will tell about how they do the screening and how collaboration works. So please show us Natalia's presentation. You have 7 minutes for that. Good morning, I'm Natalia Horyova, and I would like to present you with the experience of a small primary healthcare center in Kanyev and how we deal with the challenges of the state program 40 plus health screening. So our healthcare facility was established in December 2013. We have the top accreditation category. Our network of facilities is quite broad. So we have one municipal center with 6 village centers, also have the family health clinic and one first aid station. And one of our community health centers is almost 50 kilometers away from the city. We have almost 50 doctors, and among them, only the statistician and pediatrician do not conduct the screenings. So I would like to tell you what it all started with. I had the honor to participate in the presentation of this program by the Ministry of Health, and some colleagues present here were there as well. And it was very nice that the Ministry of Health actually decided to communicate this initiative to those who will be implementing that in the field. So my colleagues discussed various aspects of that, but I personally had one idea. There are not so many possibilities to earn money in the primary healthcare center, and well, that's not bad. So I saw how many 40 plus patients we have, and I was thinking how to implement that in our hospital. But we're very serious about implementing that. And the conclusion made by our minister was very inspiring for me. Well, primary healthcare, this is like creative work. So show us that you can. And for me, it was an important moment then. So as soon as the requirements were announced, we started thinking of how to introduce that in our facility. So now about collaboration and about the challenges. So first of all, it was we started working with our staff, and one of the difficult questions was introducing the paid services. We have a complicated municipality. We have different political groups there, and this screening actually helped me introduce paid medical services there. So in addition to the screening, we also introduced other paid services, which actually help our medical facility earn money, because we have the possibilities of providing these services. So this was a positive development for us. So first of all, we were gathering a team. So just as any team, for any team, this was something very new for us. Nobody wanted to deal with that, but we first developed the administrative mechanism, and then we started implementing that with our staff. We conducted a number of discussions. We listened to everyone. The doctors were very resistant to that, but we actually explained to them that this is our job as family doctors about prevention. This is Decree 504, and we can earn additional funds for that. So there's nothing bad in that. We had, numerous discussions about how to do that. And all possible issues and problems. But we started doing that within the facility. And at the moment, all the rural centers also conduct screening centers. We conduct screenings at home. We gather the people at first aid centers. So everyone is involved. And what I can tell you is that anyone in our healthcare facility can actually explain how it should be done and can help, do everything the patient needs to do on the phone. So it was very important to work with the staff, but we had the time. That was in January. And then I, as the head of the facility, started communicating and explaining these things during any presentations I had. I visited all sessions. We have 4 communities we service, 1 municipal and 3 rural. So I came to each of them and I talked at their municipal and village sessions and the executive commission sessions. And it's provided good results when it comes to accessibility in the village. So, no smartphones, something else, but that's no problem. We have the representatives of private bank and monobank going there, and the representatives of the Service for Administrative Service Provision coming there, and also during the visits, there is a special designated person in the facility who can actually help with joining the program, and then after they join the program, they can come for the screening to us. And I visited all these organizations. We have many of them. We have the hydropowers plant, we have Varas production facility, and many other companies, and nobody actually refused that. People felt it was very convenient, so they work by 5 p.m. so they just can spend 20 minutes and get the results in the electronic form, and then the confirmation on paper. What concerns the challenges? Local radio, we have advertisements that then we also every 3 hours invite people who are waiting in the corridors. Then we also congratulate every 100th patient. We have actually bought the bottles for water, and we are presenting these bottles to every 100th patient undergoing the screening. We don't have any specific questions or problems there. We discussed the results with the doctors, and they have seen that we have detected many cases of diabetes, of hypertonia, and this is our main job. This is what we have to do. These are our patients. And we can keep working with that. So it's not just conducting the screening because, pharmacies also wanted to earn something from that. But this is our job because then we have to, prescribe medication, define who needs treatment, who doesn't need any treatment. So this is the routine job of a family doctor. I had a look, and as of today, we have 2,000 people who have undergone the screening. So this is the result of this huge work we have done in terms of the awareness raising, and everything works fine. And I think that this is exactly what the primary care institutions have to do. A 40-plus healthcare screening, this is the possibility to actually prevent the disease and not treat it, because the best treatment is the one you don't need because you have prevented it on time. Thank you. Great. Do we have time for discussion, or will we discuss it during the coffee break? I think there may be different opinions, but I think that the most important conclusion here is that if you want to do something, there are no obstacles. You can involve everyone and anyone. But if you don't want to do that, then you can find many reasons and obstacles why something cannot work, why people will not like it, and so on. And I think that you mentioned a lot. One important thing you actually mentioned the possibility for the healthcare facility to earn some money, but we all have to remember why it is done so. The protocol has to be done completely. We have to, if a person has a problem, some medication has to be prescribed for this pathway of the patient not to, well, stop at the moment when the facility gets paid for the services. So this is what I'm asking everyone participating in that program. We have to finish, but, well, there is one person who wants to say something, and it's very important. I'll be very brief, just summarizing all these cases which we've been discussing today. My sons go to a very progressive school, and there's a very good subject, basics of health, but it is taught by the teacher who is teaching the basics of economics. So if public health specialists actually helped shape the program at school and the curriculum on well, the health-related matters, then all these questions we talked about today, like road safety, vaccination, screening, and other things. So children have to learn about it at school from the experts in the field. They say that the CDC, well, the public health center, well, staff has nothing to do, so maybe they could also, well, go to schools and teach children there. We talked about health leaders with Vlad and about this level of awareness, the culture of self-care. It all has to start from childhood. Thank you very much. We have to reflect on all things. We have reflected a bit today already, but please spend a minute of your time to think about the three things that are the takeaways from this discussion we just had. What one takeaway at least, and what action, at least one, will you take so that the situation can be changed in the areas we have discussed? 1 minute to think, and please put it down, and then you will tell us where to go. Thank you very much for this collaboration today, and I wish you a productive day today. Thank you. 1 second. I would like to thank Natalia, Volodymyr, Serhiy, Olesa, and Natalia with a round of applause. So we have a break until 12 o'clock, and after that, we'll be working in 4 rooms. This room we are in will be divided into 2 parts. Action and trust. So we will have a wall in the middle here, rather a partition, and we will have 2 groups working there. To get into that, the Vira room, the trust room, you have to go through the corridor. Another room is called support. This is to the left from here. This is actually a billiards room, but today it will be the support room. And then the joint decisions room. This is where we had networking on the first day. This is to the left from the elevator. So we had a very productive session. Now we will do a short exercise, so you can get up. If you want to, you can do it seated. So please look at the screen.
І зараз звук нам включить.
We will have the sound on, so we will name different nuts and we will have different movements. It's important to activate your brain and to eat healthy nuts. Walnut, hazelnut, and almond. Feel the energy by eating nuts, hazelnut, walnut, and almond. It's great for your cognitive abilities. These nuts are really great for you. It's a very healthy snack that you can eat daily. It gives you strength and it gives you robust protection.
Спис, дивіться, списки, щоб себе подивитися на до.
You can find the list on the boards to the left and to the right. So So you will find yourself in the list. If you can't find yourself on the list, then just decide which group you would like to join.
So we will return to our agenda, but before that, you can stand, you can sit, it's up to you. We have many great warm up activities. We will have some activities on the screen. So, this is a great experience that you will have. So, friends, when we move, do not forget about the importance of water.
Чиста вода це енергії сила. Крокуй праворуч, ліворуч, щоб кожна клітинка в тобі ожила. Повернись, усміхнись. Чиста вода, світлі думки та ідеї. Працюють чудово всі нервові алеї. Танець руками ти відтвори. І знову повтори. Шкіра й волосся сяють красою. Але воду п'ємо ми разом з тобою. Водний баланс, тримайся, любки. Чиста вода це енергії сила. Крокуй праворуч, ліворуч, щоб кожна клітинка в тобі ожила. Повернись, усміхнись. Чиста вода, світлі думки та ідеї. Працюють чудово всі нервові алеї. Танець руками ти відтвори. І знову повтори. Шкіра й волосся сяють красою. Але воду п'ємо ми разом з тобою.
Так, і зараз ми з вами будемо мати інтерактивну сесію на тему, що робить спільнота.
So now we will have an interactive session about sustainability of communities. We have spoken already extensively, but of course there's always more to add. Anastasia Podosino is going to moderate this event. She represents One Health Agency. Anastasia, the floor is yours. Good afternoon. It's almost evening already. This is the last session before the book club. How are you feeling? Do you feel strong enough? Another hour of work. Those of you who do not feel so fresh, but actually you have willpower and you're ready to stay here. My name is Anastasia. I am really happy to be present here. I came in the morning and you already have some chemistry, and I just joined this event after the first session. This energy is strongly felt. You can immediately feel it. I had some concerns about my session, but now I'm just thinking, how will we manage within 1 hour? Because you're so open, you have lots of energy, ideas, you are so willing to interact, and it's really great. It's so inspiring. I am thankful to you for having so much energy and strength to work during this session. So I listened to the events that you had yesterday. You talked a lot about communities, and I think that today we will also speak a lot about communities. Again, to me, community is the most beautiful form of cooperation, because in communities, you join it voluntarily, just because it's how you feel, and even if it's forced, you will not stay there for long. I know that the communities are not limited in their plans. It's only about their resources, which could be limited. But of course, there's always room for improvement. And the summer school is a great opportunity for us to build on our capacity. Oleg yesterday mentioned that the strength of a person is in a community. Were you present during this lecture? Yes, it was really inspirational. And I think that yesterday, this word community was an answer to the question how to find personal resilience and resilience as such. Today, we will have community as a question. We will shift a focus slightly. We've been working for some years already with communities, and to me, this question is not about creation of great community because you can find some guidelines like 10 steps to build a great society community. But what about a sustainable, robust community participating in grants, in projects, having some long term achievement? We will focus on long term vision with participation of communities and how they can make a difference. So, this is the format that we will use, the format of a lab. And I think that this is a great concept because a lab is about studies. Of course, we can spend a lot of time thinking what makes communities resilient. And I am going to share with you some studies that we could draw on. There will be practical experience of representatives of these communities which are already sustainable, are on their path to be sustainable. So I would like to invite Margareta Yatsuchnenko. You met Margareta yesterday. She mentioned about the community yesterday, and today we will focus more on the resilience of a community for ambassadors of mental health. I also would like to invite Tetiana Haldun. That's applaud to our panelists because we know that your support matters greatly to our panelists. Tatiana represent Pustomaty community of the Lviv region, and she is a member of the community of ambassadors for barrier-free environment. It's a newly created organization. Natalia in the morning already mentioned about what we do in One Health. We contributed to projects with communities in different areas. We have experts. For 7 years, we have an initiative of leaders for public health. Our Swiss partners have been supporting this project, Act for Health, MH4U, when we have trainings for leaders in public health, and that was really great to see that we have the representatives of different communities who participated in our training. That was the first year, 2019, 2025, smaller groups, and we can still see that it's functioning. This is the experience that I also would like to share with you. All of you here, 100% of you have solid experience. So let's check whether we are on the same page and let's understand better how we will explore this topic. Could you raise your hand if you're a member of any community? Yes, so maybe more hands and feel more confident. Raise your hands so that we can clearly see that they are up. We've been sitting all day long. All of you are in a community. Okay, but we will discuss this concept. And what about you having experience of being a moderator or being responsible for administrative functions, coordination effort? Yes, we also have such representatives. And who is planning to launch, to kick off a community to build your capacity? Yes, great. We have some hands. Do we have any participants who never coordinated or managed or created communities? Then show this sign like, right? Okay. It's really great. We will discuss many interesting things, and we will also discuss those things that can go wrong when we do something for the first time. That is why we can use like. We will not delve deep into the definition of community. Oleg yesterday presented his definition. There were some references about relations, trust, support, but it is quite a comprehensive definition, not easy to memorize it. I really like the etymology of the words. Do you know where it stems from? What's the meaning of community? Like doing something jointly, joint work, union, joint note. Okay, so we can clearly see that you had a great singing session yesterday and you learned new terms. Being the same wave. It it originated in Latin. The Latin language. Cam means together, jointly, and munius means to serve. And it very clearly shows what community stands for and what it consists of. We will also dig deeper into this notion and we will discuss different communities. This is our agenda. For us to understand this subject better, we will break it down into 3 levels. The first one is the foundation, something that community cannot exist without. So, what are the elements of the foundation? The next one is how to make sure that it is operational, that we can actually make things happen. What is fuel which drives this community? We will also think long term to make sure that we have a self-sufficient community not dependent on others, and that it is something that can happen long term. I hope that you still keep your workbooks. Yes. I know that this is the end of the day already, and once again, I ask you to have some reflections, and these organizers keep asking you to do that. But I will kindly ask you to write a question related to this topic that you would like to find an answer to. If we do not have a question, we're not very likely to be on the lookout for it, an answer, and we know how our brain works. If there is a question, then we are set on finding an answer to it.
А хто дописав? Хто був уважний? У котрій ми розпочали?
If you're ready, and when did we start? Because we started a bit later than planned. 20 minutes to 5. This is when we started. All right. If you're ready with your question, please let me know. So let's move forward. Before we focus on the foundation, I mentioned before, I would like also to allocate some time to find an answer to the question whether all initiatives need a community, because this is how it usually is when we have a new word, then we all want to have this for all initiatives to have communities. But is it really needed? Tatiana, what is your take on that? Are there some cases when we do not really need to build this community? I think that we do not always need a community built. Anastasia spent some time discussing that sometimes we want to do something, but the people that are with us lack understanding, or they have a different understanding. And we have this poem, but there are three different animals and they move in a different direction. Because the mere fact that you are present in this room, does it mean that you are a community? How do you know that you are a community? Well, we have different opinions. Well, we understand that everyone is very active and it's important to say what you actually think, but it is a quasi community because there was no coordination sometimes, and we know about this fable that actually it was not a good community. That is why I think that if there is no real need, it is not worth to create a community. We understand that there could be some people who want to achieve a goal, or in local governments, sometimes they set up councils just for the sake of having these councils, and they do not take any major decisions. Or there are some supervisory councils, and the members for whom these decisions are made are not part of these authorities. It might seem that it's just very easy to build a community. You just encourage people to join you, you generate an idea, and then it goes with the flow. There is a very interesting case that I would like to share with you, but there is a company which professionally deals with the community building in public and non-public sector for 15 years already. They analyze this experience and they know that this is the most costly engagement tool, because we think that it doesn't cost us a thing, that the most important thing is to have an objective, to as we gathered here for this summer school, but actually it is a long-term commitment, and it's important that you understand that you will cherish it long-term. Because if this community becomes self-reliant in 1 month, well, it's just not really going to work. In protocols, very often we will see a requirement: build a community. But what is the value behind this community? What is the value for the people, for them, for the sphere that they represent? These are some basic rules when we start something, just to understand if we actually need it. Are we ready to take responsibility and to apply efforts to build this community long term? And it's important to be honest and to use the time to reflect on that. Whom would you never want to see in your community? Because we discussed vaccination, traffic safety, Parents United. Well, I would never want to have in a community a person who doesn't really want to be part of the community, the person who has totally different values. A person who's absolutely indifferent about everything, yes. And anyone else? Margareta, what about you? Whom you would never want to see in your team of ambassadors? Yes, a person with different values, homophobes, racists.
Немає базових
There are no basic values. And the Russians, well, that's also about values. Okay, I agree. This is also about values. What about how about indifference? This is also about values. And I think that here we have this gradual transition to the topic of the foundation. And here during this session, we are kind of spinning the web. So we don't have any specific topic. We have many topics which are intertwined. And I think that this is what actually means that we are in the same field. Let's talk about the foundation. So I wanted to ask Margarita, could you share your experience when the community of mental health ambassadors was created? So what actually was the explanation? Why would people want to join this community, and when happened that? I didn't join the community when it was established, but so we need to go back 9 years back when I had bipolar disorder manifested during my resident training, and after the treatment, I really wanted to find someone to share with, to find a group. I was looking for it online because I wasn't an inpatient and I couldn't find anything. There were some foreign communities like that, which I actually observed. And in 2024, I saw on Instagram of Image for You project that peer-to-peer groups are created, and someone asked, "Can I lead the group?" And I thought, "Whoa, you can be a leader of the group." So I started getting interested in that, and I was told that yes, that's true. And that is how I got well into the community of our ambassadors. What was it about? What are these peer-to-peer groups about? This is about this concept of the wounded healer, that you have passed this way and you have healed, and you're sharing your experience of what you did to get back to work and other things. So the service was important for me. This communication with those who feel worse or those who feel better, because those who are more successful in this recovery actually show what it may look like. And generally, this concept of mental health, when it comes not just about remission, but a recovery, that it can be done in parallel with treatment, that these post-traumatic growth processes, which Olena told us about, can take place in parallel, and that there's no either or, because we all know about this two-dimensional treatment of mental health, and when there was only one line, that means you have a mental disease, and that's it for you. There was no prevention. Nobody thought about how to prevent that. And that felt like that because I was in the medical system during my resident training, and it felt like a big secret. My parents told you, well, please tell the others you had meningitis or something like that. People wanted to hide this. But in fact, you may have a mental disorder and have a community support treatment, and you can be in this top spectrum and function properly and have a job. And I was very worried whether I could stay in healthcare with mental conditions. Spoiler alert, yes, you can. I actually left at some point, but not too far away. I stayed in psychology and mental health. Did this why change today? Because you talk about it very simply and very openly and explain the experience people have and how it impacts. But when it comes to psychoeducation, this is like a very professional psychoeducation on your part. What changed in this community, and whether this is also a part of your mission? Yes, it changed because it started with this egotistic willingness to find people who are like you and who can understand you. And now I'm thinking about scaling. When you see that something works, you can see how it works. You can see people meeting every week for years. And you can see people not being able to fight depression for a long time, and then at some point they say, I managed. Extending this to the others, doing some awareness raising. I'm now doing a master's, and we're thinking about the research work that would prove the effectiveness of this peer-to-peer format. So this is a more broader view of the situation. Tatiana, what about you? You work in the community and you've been working on barrier-free environment for a long time, but then you decided to join the all Ukrainian community dealing with that. Well, the story of my involvement into the ambassador community was not that motivating. As Anastasia mentioned, well, starting from 2023, a council on barrier-free environment started functioning in our community, and I'm coordinating this area, and I was the head of this council, and we had experience of cooperation with ULEAD, with Europe. Our experts underwent training with them, and we started working with an NGO called Liga Silna, the League of the Strong. We had several audits, cooperated, implemented projects, and at some point I saw an announcement on social media that ambassadors well, are inviting to participate in a competition to be selected. And it was a very good opportunity for us to implement the ideas which could be scaled to other territorial communities. So I actually participated and I was chosen. And the first meeting of the ambassadors took place on the 7th of October last year. It was a meeting in Kyiv. And participants of that meeting were mainly public organizations, people with disabilities who volunteered, who participated, and there were very few ambassadors from among the representatives of local self-government bodies. What concerns our territorial community, I see many advantages of this because it allows for timely administration of these barrier-free environment services. It's very interesting for me to communicate with my peers, implement their ideas in our territorial community. And what is important is that the council is not just something documented. It's not a group who's sitting down at the round table. Well, sometimes we do, but mostly we walk around the territorial community and conduct audits that way. And you know that physical barrier-free environment is most painful and most costly, and people understand that. So speaking about the community of ambassadors at the level, on the national level, this is about scaling, this is about big territories, about awareness raising, and so on. But if we speak about that at the level of territorial community, it's about implementing real projects that people can actually see and touch. What can we hear behind the words the colleagues have said? What do we see here about that, well, foundation? It's about cooperation, people being interested in the topic, leadership. Vladislav is well, commenting very quietly, but actually yesterday Vladislav was summarizing and he was talking about visionary leadership. And I think that when it comes to communities, it works just in the same way. We really lack and we really need to bring up those leaders who can implement certain goals and who can, well, actually make people mobilized around this goal and invest resources, probably even more than possible, or more than somebody is ready to give you. What is very important concerning this goal is that it should, well, also correlate with this personal why. As Margarita said, it may sound egotistic, but it's important. We are people. We all have some needs to be heard, to have impact, to get support. And if your community and its goal is simply to implement some tasks of the project, like the goal is developing the capacity of something, and this is something that doesn't find any understanding and doesn't tell anything to those people who you would like to build this community with, then it will not work. You can see the clicker is tired as well. So let us think about what else could be added to the foundation of the community. We will get back to that. Who's changing the slides? You or me? Okay, I will tell you about this because this is a practical thing. It's just for you to have something to do when you get back home. This instrument is called the community canvas. You will be able to find it later, or you can follow the link. So you have the blue area in the center. You have the purpose, values, and so on here. So this is the reason, and you can use this tool, which has very specific questions. What to start thinking about when it comes to your community, or if you already have a community, you may conduct an audit and see whether you have all the necessary components in your foundation. It's a very good tool, and I recommend that you use it. So we mentioned the goal and values. The values we will apply when we are selecting people regardless of the topic. There are some fundamental things in public health leaders, ambassadors for barrier-free environment, and so on. These are the communities where people were selected. And first of all, this is agency. You know, we have many people who are very good experts and can tell you a lot about challenges, problems, what is wrong, who is to blame, what can be done about that. But where am I here? Am I ready to impact something, to undertake the responsibility? So this is about agency, and this is number one. If there's nothing like that there, then no matter what goal and what mission you have together, the person will not be able to implement that. And second and third is something similar. This is about partnership and joint responsibility. This is about the ability not to compete, but to cooperate, and about joint responsibility. This is not an obvious thing, but you know, people sometimes want to apply for training, or they apply to be selected. I want to be shown good cases, to be shared with practical experience, to show me all the mistakes. I will go on a visit, I will participate in a training, but what are you ready to contribute to this community? And when we can conduct small interviews in a close community, even a 10-minute interview can provide us with information about that. Because when you ask a person, what are you ready to give instead? So this either inspires or frustrates the person, and it lets you understand whether you have the same values or not. So while the slides are changing, let's do some exercise like this, because it's at the end of the day, and we can also hug ourselves. Do you ever hug yourselves? You know, to hug people in the community, you need to learn to hug yourself first. So hug yourselves. Feel it. You are the person who has to be loved and cared for. You've been here for 2 days already. What else could be added here to this foundation? We can actually speak about it a lot, but maybe there are some other basic things which have not been named in addition to the goal and values. Yesterday we listened to to Oleg, the other speakers. I would add trust. We are accepting all ideas. We can't discuss them right now, but we will talk about trust today. Anything else? A leader, a community needs to have a leader. Someone who shapes the values, who defines the goal. There has to be a leader. Do you know a community which has no leader, but they live? Tell us about the community. Well, for example, there are neighbors. These are people who are responsible for different areas, and then but somebody will then stops doing something and somebody else starts doing something. I can't say that in a neighborhood you have someone, a kind of a boss or a leader. They are united by the space. Well, in fact, our community also doesn't have a leader. We have two managers, Olena and I, and we are responsible for some processes, like organizational ones. But as Taras mentioned, everyone has their own areas of responsibilities. There are people who deliver training sessions. There are those who participate in Leaders for Mental Health, as you invited us. So I can't say that there is someone who is the leader. And actually, the fact that it can do this horizontal thing, that's possible. I heard someone else. For me, the joint action plan, it may be short term, it may be long term, so that everyone can see their strength and take up their niche, not the niche of their colleagues who are better at doing something. And we have to have a common understanding of what we are trying to achieve in the short term and in the long-term prospect. Yes, I would say that this is not just a joint vision, but a joint dream, common dream, which is the result of some common problem or, well, common pain. Taras, where do you live? Is it, an apartment block? When I was talking about this community, this was about community Sitsika Cave. I live there. Can you imagine that? I just wanted to make a joke and say that I would like to live where Talaras lived, because it seems like he has a very nice community, and it appears that I live there, actually. So we talked about the wrong thing during lunch. You know, I met a neighbor during, well, the summer school. All right, so we have a common dream. My vision, this is also about the common goal, but a dream gives you a little bit more power, and this is something very important. This is not me changing the slides. And the last thing, so that we can continue, is that we speak about community when a person has this feeling. Well, sometimes it's a feeling of change, but sometimes it's about the realization of identity, that I am a part of a summer school, for example. I am making changes in public health or in the leader community. We've been talking about leaders, and they've been telling, what kind of leaders are we? We're not leaders. We're just participating in a program. And then at the end of the program, they said we feel as leaders. So this is a part of their identity. And if this is a part of me, I cannot just leave. I cannot just refuse, because it's like, cutting off a part of our identity, of our heart. And it's very important to cherish this feeling in this community. Next question. What makes a community active? I don't like the word active here. That's why I indicated that what makes it a living community. Well, so I suggest that you have a look here at a theory which was developed quite long ago, but no one has suggested a better way of explaining what a successful community is made up of. So this is the, belonging or spirit, then trust. This is what Tatiana mentioned today as well. This is trade. This is about this joint responsibility. I'm giving and I'm taking, and this is a continuous process. And the fourth component, which I like a lot, in English it's called art, but in fact it's about experience. It's about, living together through some emotions. And this is what researchers believe, the psychologists who work along with this topic. These are the components of a successful community. Margarita, so if we have a look at these four components. And if you think about your community, does it work in practice like that?
Здоров'я.
Точно є та приналежність.
Yes, of course, we have it, and belonging is the first one. When we have belonging and trust, we can have some joint activities, plans. One thing does not go without another one. We also understand that there are some people who have nothing to give, and our community is open, and it is totally fine. It is this minority of leaders, they give away more, but we also take turns. Sometimes we change something because, well, things happen in our life, so we replace each other. So it is a well coordinated system of leaders, and yes, even if you're responsible for some area, you're not left alone. We have at least 3 people there. That was something that we did on purpose to have shared responsibility. And what about this synergies that you have? What is key from these 4 things? It's about the spirit. When you feel that you belong somewhere, that you belong to something greater, that we can make a difference, we can protect somebody, we can share something that people usually do not share about, to make a positive change. And when we are hurt, we can definitely see the spirit. Tatiana, if to speak about the community of ambassadors for accessibility, there was a selection procedure to select ambassadors. It was a value-based procedure. We understand also that there is a plethora of challenges here in the community. Yes, so could we have the slide back? Yes, I'm asking our tech support to have the slide back. What poses the most complex challenge? Community, cross-sectoral cooperation, it's education, healthcare, social services. What does it take to be a leader, and where you place your attention most? It's not an easy question to answer, but I think it's about responsibility, and I would like to explain what I mean by that. Community is people who know each other. If it is a small community, we all interact very often. Children visit the same school. Mostly, these are the people who know each other, and you cannot promise something and not keep your word. That is why it's important to take the responsibility. If you have some initiative, we know how important communication is. If it is about accessibility and barrier-free design, a dialogue is pivotal, and this is a dialogue not only with community members. This is a difficult time we are living in. We know that our priority is to support financially the armed forces of Ukraine. That's why it's so important for us to have a dialogue with local politicians and to communicate the idea of the importance of providing funds for accessibility. In our territorial community, we adopted a rule that whenever we have a session for the local council, we take at least one decision concerning accessibility and barrier-free environments. We have an action plan, as I have already mentioned, and it's important that we follow this plan. In terms of a territorial community, if this is a territorial community committed to the effort of accessibility, this community is making a change which are noticed by community members. I have some prompts here to support me, and this is one of the steps that we implemented in our territorial community. I have several copies, so I can share the presentation and these handouts. What is it about? Today we've been talking a lot about accessibility and barrier-free environment, that we have case managers supporting veterans, and we know how important communications is for veterans and generally for people with disabilities. We have a former prisoner of war who works with us. He initiated such meetings in educational establishments. Today we also mentioned that education is undervalued. We started these meetings for our lyceum students. They presented a book. This is a book about a girl named Alina, and this girl doesn't have a leg. When we discussed it, we came to the conclusion that elementary school kids already know how to read. And in terms of proper communication, we realized that it is important for us to work with the kindergartens. Children there cannot read yet, but they can draw. And we have a coloring book here is amongst us. And the hero of this coloring book is an expert from our team. He's a veteran. You can find this coloring book, but we had the recommendation to have a patent for the rights to this book. Another change that we made, we wrote a fairy tale for younger children. This is a fairy tale about a rabbit and about a deer, and a deer doesn't have it seems to me a horn, and a rabbit doesn't have a limb. This is what we also implement related to education, but there are also many more initiatives, and it's important for us to work with the questionnaires. We engage the community members for us to understand the challenges of the community, because sometimes we think that it is one thing, but it turns out that the need is very different. Those in our toolbox, we will have not only tools as such, but at the end there will be a QR code that you can scan, and you will have access to the presentation. You can learn more about initiatives, projects, and achievements. Today I also mentioned that the most costly thing for us is financial resources for accessibility. We had the session for one of the councils for accessibility. There was one of the comments to pay attention to one part of the road where we didn't have a single bench. So we decided to procure a bench. It cost us about 4,000 hryvnias, but the feedback was really great. It was one of the steps of those changes that community members can initiate and implement. This is when some great things transform into something very simple, because a bench is no big deal, but there is some impact still. Also, we understand that trust means a lot in this theory. Trust is also important for the foundation. For me, trust is the fuel that the community rides on, or it doesn't ride. We understand that trust is something that comes by default, it's unconditional, that we will have trust this way or another way, but we know it from our experience, and we have some findings from studies which show us the level of trust annually. Please take a look at this fact: 70% in 28 countries. So this is not a sample when you have 20 people are not likely to trust people who are not similar to them. It's about people who we are in this bubble of public health, but there could be people coming from different backgrounds. It's a different experience, different views on where we need to invest our resources into. It means that we need to circle back to the importance of values, and we will keep talking about the importance of values. There was also the percentage of people who claim that we trust those people who are not like us. Then there was the following question: why do you trust them? And this is the most interesting part. They said that because these people do not try to change me, they are open with me, saying what makes us different. They're ready to protect, support me, to stand up for me if somebody criticizes me harshly. It's just about psychological trust. That is why when we have a community with many people, we cannot really take everyone and have this yes, no, analyzing the profiles of ideal person. This is something that is not going to work. We will have the numbers of people, but the indicator of trust is psychological safety. I'm different. I have my opinion. It's different from what you believe in. But even in this room, I know that I can say that Anastasia, I disagree with you. What you say is bullshit. And I will not be judgmental to you. I will not say that, it's me who's holding the mic and you're just sitting here in the audience. Of course, we definitely feel that space when the trust is there. Sometimes it's not very vivid, but we definitely feel when we are not safe and we cannot openly say what we believe in. That is why psychological safety is a critical indicator of the trust. That is something that we really need to be aware of when we think about our communities and how to cultivate them. We will not discuss how to build trust because this is a complex topic. That is something that we can discuss as a separate topic, but it is some food for thought. Let's move forward. What we have managed to discuss already: trust, psychological safety, uh, regular cooperation. Well, it's clear that people really need to join their efforts to initiate projects, to be proactive. But there's another thing that very often we do not consider. It's really important that it enriches you, this experience, that you enjoy each other's company, because in this turbulent time, such a great source of energy. It's important to think about that and to discuss it. We also have some studies which show us how important it is, what makes people productive, thriving. And in this formula, we have hope and optimism to give this feeling that there's still something we can do no matter how uh, grave the situation is. I think that in this formula, that would be the first thing for me: the importance and the price of joy and hope that we should have. What else would you like to add here, or maybe also have some reflections? I would like to add spirit here. I mean the spirit in the sense of belonging to the community and the subject matter. If a person has values and is really committed to the values, you start building a society around you. Without being aware of that, you become part of this environment. I think that this is what's missing here. Some joint interest, that would. I also would like to add that it's important to have some trust in what we do and to be confident about what we do. If we do not believe in what we do, no external factors will create this community. I absolutely agree with you, but sooner or later, this confidence will not be there. And yes, sometimes it is about financial resources, but I don't say that it always happens. But one of the criteria of sustainability is the following. We had many cases like that when there was a project, well, USAID, for instance, it's no longer in Ukraine. Many of the things supported by them, they still exist. They are there, but we know that there is some decline, and there are some people who would like to continue these projects and they are willing to do that, but there are different values and the agenda is different. That is why, well, we understand that, well, with the funding being there, it's all about the aim. It's important that the project becomes sustainable and that communities can financially support these initiatives and projects from their local budgets. Also would like to add uh, the, the aspect of implemented project. It's something that gives you hope, that motivates you to take further steps. You said that without money, community cannot exist. So what else does it take for communities to be sustainable without these resources? Or if there is no funding, if the resources are not there, the community just collapses. We give up. Oh, yesterday we heard from Allah about community work. I work with the HIV target group of population for 30 years almost. The project was financed for quite a long time. And now we understand that the funds will not be there, that it will be the responsibility of the state to provide funding. We understand how difficult it is in times of war, but this is an infectious disease, so it spreads. In 2026, Lviv received very many internally displaced persons. We had no money and for testing, but we managed to have trainings and organize thanks to horizontal connections. Some colleagues supported us. We had free tests, and that was a good sample for us. So multi-task is something that we can do, and this is very good example when you are lacking funding, but when you have a common interest. And yes, we worked pro bono. It was our initiative only, but we still managed. I'm an operational manager of a charity. I would like to say that long term it's really difficult to work only because you have some energy to do that. And it's not only about money that we need. Let's focus on resources because we can speak about different resources which are needed. With our charity foundation, this is how we started it. Now we will set our NGO. We realize that it's important for us not to concentrate only around one source of resources. It's important to diversify, to have grant support, also to be supported by businesses, by other communities. And the third one is a commercial project that we also have. For many other projects that we already implemented and we achieved some results, we have outcomes. It means that we can provide some resources for free to some groups, but with others we can have something in return. So we can give you some resources and you provide trainings to us. So there is a program communication with people with the experience of war. We had free trainings for the teams of Centers for Provisional Administrative Services, but for businesses, they had to pay for this training.
Що точно об'єднує?
I think that the thing which definitely unites are actually maybe different things. So we found will engage. This is about responsibility. It's not about, well, saying, well, no money, no project, and that's it. I would say that this is also about building these individual interpersonal bridges in the communities, because people who work together for a long time and who are united by joint ideas, they become friends, and it's a very good thing when somebody in the community has a problem. Everyone else in the community is helping to solve the problem. Margareta, could you briefly tell us, because we have to finish, yesterday you mentioned that you already have a CSO. So what is that? What do you need it for? I don't think that every community should turn into an NGO or a CSO, but why did you do that? We talked about that. We talked about diversification so that we can apply for different grants and other things. And MH4U helped us a lot in that regard because they did not just tell us register an NGO and do this or that. They supported us, but these were our decisions, and whatever we planned to do was our initiative in terms of awareness raising, in terms of research, in terms of peer-to-peer support. And we would really like everything we have to keep existing because it's already an ecosystem, and we would like to help the others create these ecosystems. And I think it's also about, well, recording the experience. It makes a lot of sense because you work all the time continuously. You have this experience in peer-to-peer groups and other initiatives, so you can document it and, well, have a say in the community, not just remain an informal community, but you can scale it for other communities. It's very important. Is there anything else concerning sustainability and about long-term resilience and sustainability? It sometimes seems to me that closed communities, well, arrive at a point when they have to open to have this, well, potential to keep developing and to have an influx of new ideas, because it happens so sometimes that, well, everything is at a stalemate and the community is not moving forward that, and then, well, this fresh blood, as you say, is very important. Speaking of, for example, about the community, well, in a territorial community, it's very important to collaborate with the public sector, with the NGOs who work in different areas, because they make the community stronger, as I've mentioned, even with lack of financing. And our example, the cooperation with the League of the Strong NGO, is about getting funding to procure different rehabilitation means used in the territorial community. What concerns the community itself and its long-term work, I really liked the idea which Oleg Romanchuk mentioned yesterday, that we have to value everyone, not place a crown on somebody's head. This is important in any community, and we understand that it's not always about money. It's about trust. It's about partnership. And when a person is valued in a community, it's not always well a whole project. Sometimes it's just about the meeting which inspires. It's about supervision. It's about joy. Sometimes we have public health leaders meetings, announce a topic, and people very often join without having any idea what the topic of the meeting is. They join just to get a bit of this joy and hope, trust and belief that we are here and we are together. A passive or a sad person can never will attract anyone. If you have no watch and you need to know the time and you walk in the street, you're not asking the first person. You will be looking at people and you will ask the person who you subconsciously like. And this is how this community is also shaped, because it unites the people who see value in this particular community. Thank you. Oleg talked about community work yesterday, and about relations and about mutual healing and working together, helping each other. Well, that's very important. Thank you very much. Basically, this fresh blood, it's about, well, going beyond that community. You have come here, each of you has their own community, but there's this interpollination with the ideas you hear. You broaden your horizons. This may be about systemic transformation, Margarita mentioned, moving towards an NGO, or a CSO, or any other, well, legally registered form, or it may be the grassroots leadership. A community has to think about it if this is a long-term thing. Let us summarize. What have we been talking about today? We talked about the foundation, where we have not only the goal and the values, but also joint dreams, common dreams, and an action plan. And I will share the presentation with your reflections added to it. Then we talked about the fuel, about trust, about joy, about common healing, common activity, and about, long game. In the previous 2 days, we have had our own reflection. And, I've never thought about some long-term things. And I think that the question of resources appears when this goal is not ours. When it's not bigger than our ego, which actually makes us get up from the sofa and start doing something. But when this goal is a dream, when this is something big, we don't care that we have no resources. We care so much that we cannot just let our hands down. We will not be ourselves if we don't have something. Like if we understand there's no money, but we need to do something with HIV patients. So this is really a question of whether this is really my goal and whether I'm honest with myself. We may reflect on that. So please go back to your work books, look at the questions you put down, and think whether you have found an answer to that question. Maybe there's one idea you need to think about after the session, or maybe something you would like to discuss over coffee. Think about it, please. Let us thank ourselves, Tatiana, Margarita, Could you show the last slide, please? Because I promised a QR code with the links to the presentation of the community. A QR code with the contact details. If more is needed, I will be happy to share the experience of our team at One Health. And I wish you a lot of inspiration to collaborate in the next couple of days. And the link is to the products of post-traumatic community. Just another minute, let us thank Anastasia, Margarita, and Tatiana. And we will meet back here in 15 minutes. We will have a meeting with Vladimir Sanchishin. Please take the books and take everything away from